Hi, my name is Noelle Lalario, and I am a palliative care social worker about to open a clinic up in Swedish Edmonds for palliative care. And I think this is a really important topic because I frequently see patients and their families really struggling with these questions about what they want to do, what they want their healthcare to look like when they're in the middle of a crisis or a new diagnosis. And it's very stressful for folks to answer these questions or think about these things when they're faced with it versus having the conversation early and thinking about it when they're in a place of calm. And so I hope you get some good information from us today.
And my name is Kathleen Fraguela Rios. I am a behavioral health specialist in primary care. And this is an important topic for me because oftentimes I see people on the other end, right? I see loved ones that are kind of like upset because their parents are going through some illness or they themselves have gotten a diagnosis and they're not sure what to do. And so having these conversations is important because it helps just in the long run in the healing process. I also see a lot of people with grief after some of these decisions haven't been made or the outcome hasn't been kind of what they wanted. And because in primary care, I see everything, I also encourage people to feel these out in their medical wellness exams, which is when physicians push for this.
Great. Well, thank you both so much for joining us today. I think this topic is really important, but I think some people might not be familiar with what advanced care planning is. So could you kind of tell us give us a definition of what that is?
Sure. So advanced care planning is really the process that an adult can go through regardless of their age or what stage of health they're in. And it's really about learning what sort of decisions they could be making regarding their health. And if they were in a situation where they couldn't speak about their decisions on their own, what are some of the decisions that they would want that align with their values and how they really want to be living? Often these conversations should be had with family members and healthcare providers so that everybody knows what those wishes and values are and can follow that in your medical care.
So can you cover why is it important to have an advanced care plan? You kind of touched on it a little bit, but can you expand on that a little bit more? What makes it so important to have a plan in place?
Right. So, ask yourself if you are in a medical crisis, if you're in an emergency situation, would you be able to make decisions on a split-second notice based on your values or what's important to you? Or even more, as Kathleen talked about, what if you couldn't make decisions for yourself? Would your loved ones know what decisions you'd want? Would they all agree? Is there somebody that has been designated to make those decisions for you that you've chosen and you've had these conversations with? Again, oftentimes we're faced with these decisions when we're in shock, when we are upset, when we're faced with something that feels insurmountable. And so it's really hard to make good, value-laden decisions when you are in shock, when you are upset, when there's a lot of emotions involved. And so having these conversations ahead of time really helps set the stage for making good decisions that are based on who you are and what's important to you, and having consensus and communication with your family and your provider so everyone's on the same page.
Mm-hmm. Great. And do you have to be a certain age to do this, or can you be like in your 30s? Does it matter? Does age really matter? I mean, obviously, as you get older, it's more important, but do you have any recommendations on that?
Everybody should at least have the conversations because it doesn't discriminate, right? Like if you're in a car accident, if you get some sort of illness, like it's not going to discriminate on age. And so it's really important to have those conversations with the people you love who might be designated. And so that they know what you would want. So, I mean, there's really no age limit on having the conversations.
I did mine when I was 30.
Okay.
My friends all thought I was crazy.
But you were prepared.
I'm prepared. Luckily, I haven't had to use them yet, but I'm prepared.
Good. So our next question, who should do advanced care planning? And we kind of touched on that a little bit with the age, but who would be best, to start that conversation?
Yeah, I would say, if you are facing a serious illness, if you have a diagnosis, for sure. But really, anyone should do it. And then we look at when do you update or when do you consider thinking about it or changing it or reflecting upon it, because it really is a living document. It's not something that once you do, it's set in stone. It's something that you should really explore. And they talk about re-exploring them with the 5 Ds. So anytime you have a new diagnosis, anytime you have a decline in your health, anytime if you go through a divorce, if there's a death in the family, and then also just every decade. So thinking about that in terms of decades, great. Do it when you're 20, do it when you're 30, relook at it when you're 40, and so on. And let it age with you, because things are going to change as you get older and as you have children, or as you retire, or as there changes.
As your health status changes,
absolutely.
as your values kind of like get realigned. We're constantly kind of evolving in our decisions with new information that's coming out there. And so it's really meant to be a living document. It's really meant to kind of go and age with you in a way. So we talk about advanced care planning as kind of the conversation, but when we're talking about the document, we're really referring to the advanced care directive. So I think that the biggest thing is just make sure that you're having the conversation, and then eventually that you kind of like getting in writing. I think it's very important as well.
Great. So you brought up advanced directive. So what's included in that, and what does that process look like?
Yeah. So an advanced directive is the actual legal document that people fill out that designates who is the power of attorney. So who's going to be that person that's going to make the decisions for you? Who's going to be that person that you know is going to carry out your wishes and your values, and is going to make decisions that align with what you would want. Other names for an advanced care directive, I think most people think of them as a living will, which a living will is also a legal document that usually you share with your provider, and it tells what sort of treatment you would want or would not want given certain health situations. And so that's part of what could be included in an advanced directive document. Other forms that kind of can enhance or are part of the advanced directive are there's the POST, which is the physician order for life-sustaining treatment, which is actually an order that the physician does and puts in place that designates, and this is a conversation that you would have with your physician ahead of time, obviously, that says what sort of treatment you would want. So whether that's a do not resuscitate, whether you would want CPR, and anything else that I'm forgetting.
Yeah, I mean, it's really a form that you would have in your home.
Yeah.
It's bright green, and it really stops medics from doing CPR if you don't want CPR. So it's the idea is if someone comes into your home and finds you down, what would you want done if you couldn't say?
Yeah.
And so it's really more for people with a serious illness. Or maybe reach a certain age and feel like CPR wouldn't be something they'd want to choose. It does talk a little bit about antibiotics and artificial nutrition.
Yeah. And one thing that I will mention is sometimes that the advanced directive is different from the living will, and that the advanced directive usually is a little bit more comprehensive because it talks about the artificial nutrition, it talks about artificial hydration, whether you would want dialysis, whether you would want a blood transfusion. So in a way, it's a little bit more comprehensive than a living will. And the advanced directive is usually enacted when you can't make decisions for yourself. I think that's very important.
Yeah, and I think the other nice thing about advanced directive that has changed over the years is it used to be really focused on medical interventions. And these days it also includes a lot of information about who you are and what's important to you. Like you would like music played at your bedside. You really enjoy being read to. You want someone to hold your hand if you can't ask for that. It talks about quality of life as well as as well as medical interventions. So it's a really much more engaging process to talk about like who are you and what's important to you to tell people in the moment.
That's great. And I imagine that's so much more comforting for your family as well. If you were going through something like that, that person's being taken care of.
Yeah, in the way that they want.
Yeah.
I would also say that we, talk about this. It's important not just to do the documents, but to talk to your power of attorney and your family and your providers, because you might have chosen one of your kids to be your power of attorney, but if you don't talk to that kid and give them the document, they're not really going to be able to follow your wishes or know that that's what they're supposed to do.
Yeah.
And to let everyone else who loves you and who wants to be part of your care, let them know too, so that everyone's on the same page and you've given those wishes to everybody. So it's not just about the documents, it's really about the
conversations. Yeah, because I think that an important thing to mention with powers of attorney is that oftentimes people choose somebody and the person that you choose doesn't have to sign this is chosen, and sometimes people don't even say it's like, oh yeah, I chose my oldest. And you're like, do they know that that this this is something that they're signing on to do. Often people don't know. It's like, oh, I don't know who my parents chose,
or they don't have a copy.
Yeah, they don't have a copy.
The hospital is like, who's the? We need a copy. Like, I don't know.
Yeah. So I think that it's important, again, the conversation, because oftentimes too, the person that's chosen, like, what if, like, when they get all this information, they might have other stressors going on in their life, and they're like, what was it that we talked about? Somebody else can be the person, like, oh, remember, this is what was chosen, and this is what they wanted. Just include all of that in the care.
Yeah, and just as a reminder to the audience, some resources have been posted in the comments section if you're interested on learning more about how to start that conversation. And feel free to submit any questions that you have in the comments section or through private message if you'd like to remain anonymous. So some other questions that we have: what are the most common reasons people don't have an advance directive set up?
I think a lot of it is just misconception. I think that most people put it off because they think it's when you have a terminal illness, or, like I said, when you're 65 and you're getting that welcome to Medicare kind of exam, when your doctor's like, oh, welcome to Medicare, you should be filling out an advanced care directive. And I think that oftentimes people think that whatever they decide now is set in stone. Like, they don't think of it, like we talked about, as a living document, that it's meant to evolve. And so sometimes thinking of, like, oh my God, I have to choose what I want if I couldn't choose for myself, even the thought of that can be very scary. And we often tend to avoid what we're afraid of. So I think that that's part of the reason. I will say this. Yes, it is sometimes an uncomfortable situation or conversation to have with somebody. But even if that discomfort just lasts for a few minutes or a few hours, it's going to save so much discomfort on the other end of possible, like, days, weeks, or even months of not knowing what could happen.
Yeah. So we did get a question, can I change my decision maker at any time, or is that too complicated? And I think we just covered that. This is a living document that can be changed at any time, right?
Yeah, there's actually two ways to do that, especially for the durable power of attorney. A lot of forms include a revocation at the end that you can go ahead and fill out and say you're revoking that power of attorney. But if you do a new power of attorney, the most recent document is the valid one.
Yeah.
And again, the important thing is to talk to people about it. So, and it happens, divorce, your parents, maybe your parents are your power of attorney and they age out of being able to do that for you, or your brother moves across the country. And so it's good to, continue to look at that and make sure the person that you have as your power of attorney is someone who's local and present and involved in your life and understands your wishes and is willing to make those decisions for you if they needed to. And so it's good to communicate that. Yes, you were my power of attorney, but now I've changed it to my daughter because now she's of age and I'd like her to make decisions for me. So,
okay. And the same with the advance directive. It's fairly easy to change that if you wanted to, because most of the time it just requires like 2 witnesses, at least here in the state of Washington. Yeah. Some of them are it needs to be witnessed. So if you make changes, you just need 2 witnesses to sign for it, and then it's a new one. But when you change it, it's important to give those copies and have those conversations with your healthcare providers and the people that are going to be making those choices, and give copies to everybody that's involved in your care. That's often what I tell patients. It's like, even if you come here for primary care, if you go somewhere else for something else, they should have a copy. Everybody that's involved in your care should have a copy.
Okay, yeah. Great. So we did get a question. What if I don't have a lawyer to help me complete my advanced care directive?
So an advanced care directive doesn't need to be done by a lawyer. A lot of people do, because as they're making their last will and testament, they also do a lot of that power of attorney and all that. But you can find actually copies of the documents. I think you gave out some of the links, but it's really easy to find a lot of free advanced directive, power of attorney, all that on the internet. Most healthcare providers have them readily accessible. So your primary provider, any specialty providers, a lot of them have it as well. And you don't need an attorney to do it. Again, what Kathleen said is you fill it out. You have, in the state of Washington, you can have it notarized by a public notary, or you have 2 witnesses who are not part of your advanced directive, preferably not family, or can't have care providers. But, maybe your neighbors or some friends come over and witness it for you, and you do need 2.
Okay. Good information. Thank you. So we kind of touched on this, but how can people get started? What does that process look like?
I think the conversation. We can't stress that enough. You get started with the conversation of being able to sit down or call somebody, whoever's gonna be involved in your care and is gonna be there for you. Have that conversation of what's important to you. What does having quality of life mean? What are the things that are important for you in feeling like you're having quality of life? And what are your values, and how does that reflect into your plan of care?
Yeah, no, but I think that as you're thinking about that conversation, if you are dealing or facing a serious illness, it's actually more effective to maybe have that conversation starting with your provider, your physician, to engage in like, what is your illness? What's the trajectory? What are the decisions you may be facing? And to start the conversation there, because then you can start having a more realistic conversation about where you're at in your healthcare and what decisions you really need to talk about with your family. And a lot of physicians are willing to have those conversations with the patient and the family, especially if they're dealing with something very serious.
Yeah. So it starts with a conversation, but hopefully it leads into the completion of the documents. So actually filling out the power of attorney document, hopefully filling out the advance directive document, or living will, or whichever documents people choose.
We sent out some links, I think, as well. There's a wonderful card game out there you can purchase or even use online that starts making you think about your values and decisions you might need to make and what's important to you, as more of a fun way to start the conversation if you feel a little stuck or you're not sure where to start.
Okay, great. And you spoke to some of the resources that are available, and we have some in the comment section here. Are there any for family members, like on the family member side, for someone that might be going through something like this or putting together an advance directive? Do you have any recommendations for that?
Can you be more specific? Like, so if to be support, well, I mean, a lot of the resources can be applied kind of both ways, because I think that on the family side, just being informed of, what would be included, or what are some of the questions they could be asking, goes a long way. I feel like I think that we talked about, like, I'm going to show this one, the Conversation Project. Has a conversation starter kit, and some of these are really helpful no matter which side you're on, because again, I think that oftentimes what happens is that we get stuck on what we would want for ourselves, and sometimes it's hard to listen to what someone else would want. And so even using this as a guide of, okay, so these are the things I should keep in mind for somebody else, or questions I need to be asking if I'm going to be the one making these decisions, goes a long way.
So we have a question from Greg. He says, sometimes I think that when I'm talking about these kinds of decisions, it means I'm almost saying that they are going to happen. Any advice for people like me that feel that way?
Yeah, I mean, I think a little bit about how we have insurance, right? If I buy car insurance, does it mean I'm going to get in a car accident or I'm going to cause a car accident? If I buy house insurance, does it mean I think that there's going to be a storm and it's going to knock a tree into my house? Hopefully, no. I'm a glass half full person, but I do think that we do buy insurance. Our culture is the culture of kind of thinking in the future about catastrophe and wanting to do things to protect ourselves from that financially. So why would you not do that with yourself medically? It's just looking at like, okay, I'm hoping that won't come to pass, or that will come to pass in 50, 60 years, but this is my insurance that if it does come to pass, I have set something up for myself. I don't know if that helps, Greg, hopefully.
Yeah, I think that the biggest thing is, we make decisions every day. We make decisions about when I order my coffee, how I want it. When I order my food, how I want it prepared, how I want to eat that steak, how I want to do some of these things. And oftentimes we make those choices because of something that we like. And so why isn't this something that we want to prepare for? And why isn't this a choice that you want to talk ahead of time so that somebody's not ordering for you when you're sitting at a restaurant? You're like, that's not really what I wanted. So I think a lot of times is if you take away kind of like that pressure of something bad is going to happen, it's really more about like, I'm my best advocate And so I really need to let other people know this is what I really want. Yeah, being proactive.
Right.
Well, in this day and age, our medical technology is insane. I mean, there are so many things they can do to help sustain life. And a lot of them are wonderful, and not all of them are appropriate for certain situations. Not all of them bring quality of life and bring the things that are important to you. And everybody's in a different place with what they would want. And so it would be awful to, order your eggs sunny side up, but then have someone else decide if you're going to have artificial nutrition.
Yeah.
Right. Well, we've answered a lot of questions, and you guys have covered a lot of topics today. Is there anything you wanted to just drive home for our audience that's tuned in today before we wrap it up?
Have the conversation.
Yeah, have the conversation.
Have the conversation.
Start the conversation.
Start the conversation. Just start it. Yeah, just at least start it. I think that's the biggest thing. Just start the conversation. There's, like you said, a lot of links. There's information out there, even on the Swedish website. They have the kind of like talk about it guide, how you can talk to others about your choices, and it talks a little bit about some of those choices that you could be making. And then we have the advanced care directive also on the side to talk you through some of the steps and some of the choices that you can make. So just start the conversation.
And if someone wanted to talk to their primary care provider, they could kind of help too, right?
Yes, absolutely. That's always the best place to start because they will know and are involved in your care.
Okay, fantastic. Well, thank you both so much. And thanks for everyone that tuned in today. And after the live is over, the link will be available to share and to rewatch. And don't forget to like the Swedish page and to subscribe so that you can be alerted to upcoming Facebook Lives. Thank you both so much, and thanks to everyone that tuned in today.
Thank you.
Thank you.